Hey everyone, welcome to the Brain Body Reset Podcast. I'm your host, Spencer Zimmerman. Beyond the diagnosis and symptoms, there's a path to feeling better. Dive into the world of brain-body connection and learn how to optimize your health.
We're going to cover post-concussion syndrome treatment and help you uncover what's been missed in your search. We're going to cover everything from diagnosing a concussion, like, is this really what you're dealing with, to how do you make that diagnosis, to some of the myths, as well as dive into what treatment should look like versus what many people are actually getting. And when you really understand what a proper evaluation looks like, it helps you to start piecing together what treatment should look like as well. Because what you're going to find out is a lot of the treatment that's being done, it's not really targeting what's truly happening in the brain with a concussion. And this is why so many people are trying one treatment after another and after another. And they're frustrated because they are not getting the results they are looking for. So this is going to be a very in-depth masterclass that we're going to cover today. If you're watching this video or listening to this podcast version, it's because you've either had a concussion or maybe you're wondering if you did have a concussion that wasn't diagnosed. There are many different symptoms that individuals may have if they've suffered a concussion. Now, it doesn't matter if this concussion was a month ago or even 5 to 10 years ago, which you're going to find out. But these are a list of the symptoms people can have, from chronic fatigue to brain fog to headaches to memory issues, mood, and much more. Needless to say, many people have these symptoms, and it doesn't mean if you have these symptoms, you necessarily have a concussion. But it is a reason to look into the health of your brain no matter what, because these are signs and symptoms that the brain isn't as healthy as it should be. First, why do I care so much about the world of brain health and concussions? What you see in those pictures, you see I have 5 girls. Yes, I have 5 daughters. And then you see my wife. But what you don't see is the fact that my wife actually suffered 3 different concussions when she was a teenager into her young adult life. Left her with ongoing symptoms: chronic fatigue, brain fog, headaches, dizziness, mood changes, sleep issues, and much more. But she was never diagnosed. She was told, hey, you know what? You're a teenager, you're going through puberty, and everything got explained away on that. While one of the doctors acknowledged that she had a whiplash, they didn't do anything for treatment. And when she continued with headaches, what did they tell her? Well, you need to get more salt, increase your salt and sodium intake by eating potato chips and drinking lots of caffeinated beverages, Mountain Dew, and things like that. Needless to say, that didn't work. And I was working at a brain injury clinic at this point in time when we discovered that's what she was dealing with. Most of the people who seek out care for concussions know that's what they are struggling with. But probably 90% of people who should be looking for help with concussions have no clue that is the reason why they are stuck and they're not actually getting better. And so we're going to dive into some of those myths and how that hurts people. Beyond that, my grandpa suffered a traumatic brain injury as well, where he went through the front windshield of a car, ultimately set the stages for neurodegeneration as a result, because that wasn't dealt with either. So this definitely hits close to home for me, and it's why I've made it my life's mission to really understand this, and why I've got the amount of training I have on this topic. And as a result, it wasn't enough for me just to get my chiropractic degree, but to go back in my nurse practitioner degree. And I'm the only dual licensed chiro nurse practitioner who uses functional neurology, functional medicine, and peptide therapy in the state of Florida, and one of the few in the entire United States. Beyond that, I'm a best-selling author, and I've been on TV as well talking about brain health. First, concussion myths. There's a lot of concussion myths out there that prevent people from getting proper diagnosis or from realizing that it's their concussion that impacts them down the road. I was actually talking to someone this week who told me they've been in multiple car accidents and they had many of those same symptoms we've discussed. And they said, but can a concussion really impact you that long down the road? And the answer is absolutely yes. So That's where we see the myths of everyone recovers and no long-term effects, because that is very, very false. When you look at the research of those who are diagnosed with a concussion in the emergency room, about 50% are still struggling at least a year down the road. We also know that concussions are linked to chronic traumatic encephalopathy, Parkinson's, multiple sclerosis, Alzheimer's, and other forms of dementia. Beyond that, just a life full of mood-based disorders and everything else that's just unpleasant, and it's really not necessary if the proper treatment is received. When we look at these myths, imaging is one of the big ones that's really, really frustrating, because people go to the emergency room or they'll beg their doctor for imaging and they'll get a CT scan or a standard MRI of the brain. And they're told, hey, we did imaging and your brain looks fine. And they say, oh, well, it couldn't have been a concussion. Now, this is absolutely false. If your imaging is fine, that means nothing at all in the world of concussion. What it does mean is that you didn't have a more severe traumatic brain injury. There's no bleeds, fractures, or tumors, right? But it does not mean you don't have a concussion. Even diffusion tensor imaging, DTI, which is done to spot concussions, it's not perfect. So having a positive one, well, that definitely means a lot. It doesn't necessarily mean a ton if you're normal on that imaging. Next is that there's no treatments available, and that the best thing to do is to wait it out, go sit in a dark room and sensory deprive yourself. If you are still being given advice like that, know that those providers are 100% unqualified to even have a conversation about concussions, because that's just simply not true. Okay. They need to leave the Stone Age, because that's not the reality of the situation that we're dealing with. You don't have to lose consciousness. About 90% of concussions will not lose consciousness. And then last one we'll cover is you must hit your head. That's absolutely false as well. While many individuals with concussions may hit their head, whiplash mechanism is more than sufficient to cause it. So don't say, well, I didn't hit my head, I didn't lose consciousness, I wasn't thrown up, so therefore I couldn't have had a concussion. So when we look at the diagnosis, this is super important. So step number one is, do you have a plausible mechanism of injury? Car accident, slip and fall, a direct blow to the head, big jolt to the body that we see in sports or other activities, that would be plausible. Number two is clinical signs. Now, you do not have to have these clinical signs to meet diagnosis. So what are some of those clinical signs? Vomiting, completely confused and disoriented, as we've seen with Tua Tagovailoa in football, collapsing, complete loss of consciousness. Okay, that would be a clinical sign. If you have that in the mechanism, you automatically get diagnosed. But that's not required. And unfortunately, many providers will say, oh, well, you didn't have that, so therefore you couldn't have suffered a concussion. That's false. Next, we're going to look at acute symptoms, and we're going to go through those. And then after that, if you have acute symptoms in combination with clinical examination findings, which we are going to discuss, because most people never have a proper clinical workup for a concussion. If you have those, you automatically meet it. And then lastly, if you do have DTI findings, other imaging findings, then you automatically go into the MTBI realm. And the kicker is you can't have a better explanation for these, right? So if you fail your balance testing because you're drunk, well, then you were drunk. It doesn't necessarily mean that was from a concussion. So let's make sure that we understand this appropriately. First thing I want to do, though, show you is what actually happens in the brain with a concussion. So we're going to pull up a video really quick. So our brain really has the consistency of jello. So what happens when we get rattled from either a blow to the head, we take a whiplash mechanism. So I'm going to show that one more time. You see it oscillates back and forth. And so one of the things that really confuses a lot of people, especially those when they hit their head, is they'll say, look, I hit the front of my head. Shouldn't I have more issues with the front? But when you see it oscillates like jello, it's like, actually, no, there's what's called coup contra coup, right? Where it maybe you get hit in the front, so you get damage to the front, but then it oscillates to the back and you get rebounding injuries as well. So it's not just as simple as hey, that is the only thing that is present and that can occur. And I think that's super important that we understand that our brain really is like jello. And so it doesn't take as much as we expect for these injuries to occur. And this right here is from the American Congress of Physical Medicine and Rehab, the guideline criteria. And this is as well. So when we look at these symptoms, this is super, super important that you understand this. The physiological disruption of brain function is manifested by 2 or more new or worsened symptoms from the list below. And this is super important that it's 2 or more and that it's new or worsened. I can't tell you the amount of people who are like, well, I had headaches before this happened, but now I have more headaches. Or I had depression before this happened. Now my depression is worse. And unfortunately, in the world of mental health, everything gets overly blamed on depression and anxiety. They're like, oh, well, John already had depression before this accident occurred. So therefore, the depression is the causative factor, when in reality, it's like, well, yes, he absolutely did have depression. It was more mild, though, and now it's more moderate to severe. So this was aggravated as a result of the concussion that they took. So we need to be sure that we don't explain away the reality of what's being dealt with on that. When we look at this, what are some of those symptoms? Confused, feeling disoriented, dazed, headaches, nausea, dizziness, balance issues, light, noise sensitivity, brain fog, feeling slow, memory issues, concentration, right? So, and it says as well, and I don't have it up on here, but normally these symptoms are going to appear within the first 72 hours. So you're looking for 2 or more new or worsened symptoms compared to before that injury occurred. If you have that, and then you have the appropriate diagnostic findings, then you absolutely do get the check mark. And this is important that you know this, because this is how you advocate for yourself. A lot of people are not diagnosed who absolutely should be. And then on the other end, there are some people who are being diagnosed when they shouldn't be. And unfortunately, that does occur in the car accident space. People will be diagnosed based upon a brief history with no objective evaluation. The objective evaluation is absolutely key. So there's just another graphic of what things look like from that end, right? So those are the symptoms that individuals can have. So you've got the symptoms, right? You've got 2 or more of those. What should the evaluation look like? Maybe you've had imaging in the past. Maybe you've had your reflexes checked and you've had a provider who talks to you briefly. But is that really an evaluation? And the answer is absolutely not. I'm not going to pull up something from the University of Kansas that they did as part of their research that they recommended, but it's not an examination. So what should you be looking for? Because one, we've already talked about the shortcomings of imaging. Imaging is not perfect. And if we require imaging to be abnormal for concussions, which is not required, but if that's what's portrayed, then that leads to a lot of misdiagnosis. When we look at those findings, now I do have brainwaves in here as number 3. When you look at the research from the American Congress of Physical Medicine and Rehab, it is vestibular function, aka balance testing, and then it is eye movement assessment. This is critically important that these are done. So what does some of this look like, right? Balance testing. I always recommend find a place that's using computerized balance testing. So you'll see on the top is you look at eyes open, eyes closed on a firm surface, followed by eyes open, eyes closed on a blue balance pad. You will routinely see that the balance with eyes closed gets progressively worse. This is a common finding in concussions or other types of brain injury because we become visually dominant. And so when we close our eyes, that now gets really thrown off. One of the questions people always ask is, but my balance, I don't think it's that bad. I'm not running into stuff. I'm not tripping. So I think my balance is pretty good, doc. And, that actually doesn't correlate at all. It doesn't correlate at all. The amount of people who will swear up and down that their balance is great, and then they perform their balance test and they bomb it, it's really, really high. Now, here's one of the other things that you can do. Okay. This is called a I've got this sped up, but ultimately you have someone march in place, their arms up like that, eyes are closed. And we want to say, okay, are they marching forward? Are they marching backwards? Are they turning when they march, right? So you'll see here, my staff member, when we did this, she marched forward about 1.5 feet, so slightly outside of the range of normal. And then she turned 45 degrees to the left. So there are others I've done who will march 3 feet forward, okay? And we're typically letting them march for about 30 seconds to see what's happening. So that's an important one. Also, tandem stance, 1 foot in front of the other, and then one-legged stance as well, and looking at that. So that is part of the balance assessment that should be done to see how people do. Next, eyes are known as the windows into the health of the brain. Personally, for me, the days of saying, hey, look at my thumb or my finger and track it, that should be long gone. Maybe it's got a place on the sideline. But when we're talking about actually being in a medical clinic, look, we've got to do stuff better. You wouldn't tell someone they've got a broken bone by purely being like, oh, your arm really hurts and it doesn't feel right. I think you got a broken bone, you would do an x-ray to say, look, we've got imaging that shows here it's at. And then what do? As your bone's healing, they do more x-rays to make sure it's going through the proper healing process.
If you're finding this information valuable, please share this podcast with others and give us a 5-star review, as that is the only way this podcast grows. Please continue listening and keep enjoying.
And with concussions and brain injuries, it really should be no different. So eye movements are one of the best ways to evaluate this. And what you'll see is we can use computerized software. Okay, this is called video oculography or video nystagmography, where they're going to wear goggles and we're going to record everything that their eyes do. So this is someone who's looking straight ahead, and then they shift their eyes to the left. And they should be able to keep their eyes still. So this is called gaze fixation. And this person does not have the ability to gaze fixate. When we see issues with eyes, what are some of the issues we see? Well, headaches, neck pain, difficulty with focus, concentrating, word finding, memory, chronic fatigue, brain fog, and other things in that arena. And part of the reason we see so many issues with the eyes with concussions is that it's routine that you get brainstem injuries to this. Not necessarily brainstem injuries that pop up on imaging, but you do get damage to the brainstem centers. And that's where your integrators for eye movements live. It's right there in the brainstem. So eyes are a big thing. Next, we're looking at smooth pursuit. So they're tracking a target that's moving left and right, nice and smooth. And you'll notice this is anything but nice and smooth. And unfortunately, in my experience, 99% of people with concussions will never have this testing done. At best, they follow someone's finger, but they never use this. And this is the highest level of objective testing that can be performed. So that way, if you are improving, we can say, hey, look, here's where you're at, and here's where you're at now. We're not leaving it to chance, because no offense to anyone out there doing concussion work, your documentation, when you look at this, you're going to put, oh, there's saccadic pursuits or saccadic intrusions, catch-up saccades with pursuits. And that's what you're going to do. But you're not going to adequately say like, oh man, here's the amplitude. Here's how much it's happening. We all know that. It's never going to be documented, right? Now, when you see this, some of you are like, oh, that's nystagmus. If a provider tells you that's nystagmus, that's kind of a red flag that they don't know what they're doing. Okay. That is not nystagmus. So nystagmus, by definition, is a slow phase and a fast phase, right? So if you see the eyes drift slow and then beat back really, really fast, whether it's left or right or up and down, that is nystagmus. And unfortunately, it's greater than 90% of the time that I hear that term being used inappropriately. So let's make sure we're using the right terms, because it definitely means different things. And then the last one I'm going to show you is this is vertical pursuits. So vertical pursuits are routinely impacted with concussions as well. And these can be off for months and years following the injury. Good thing is when we do this testing, right, if we see eyes like this, where there's saccadic intrusions, there's horizontal deviations as they're tracking up and down, And then you're like, dude, that made me tired. It gave me a headache. It made me nausea. It made me have dizziness. Any of those. You don't need all of them. But it becomes very predictable that when that gets fixed, that someone's going to improve and actually get better. Last one I want to put on, because this is getting more popular. It's not part of the official consensus at this point in time, but people are getting brain mapping using quantitative electroencephalogram, QEEG. And with this, we look at how the brain is functioning, the patterns of the brain waves. There's more research coming out on these findings in concussions. So it is definitely something to keep your eye out on. But is it something I would ever use as a standalone? Absolutely not. I wouldn't. Because even if it's off, it's not necessarily super actionable. But I do like having it as a pre, and then after we do treatment, repeating it, because this will change without doing things like neurofeedback, which we'll talk about neurofeedback briefly. All right. So you've tried different things. You're not getting better. Why are you not actually getting better? We're going to pull up something. This is known as the dynamics of concussion. Okay. This is in the research paper on this, and this is the graphic from it. So from the time you have an impact, you get a variety of things that happen within the brain. And that's basically everything here. You get cellular energy imbalance, you get neuroinflammation, you get blood flow issues. Okay. You get neuronal damage, mitochondrial dysfunction, you get all sorts of stuff. You can get axonal injuries that leads to a wide variety of symptoms, right? We get nausea, visual impairment, feeling out of sync, balance issues, dizziness, vestibular issues. We get emotional things, light, sound sensitivity, sleep issues, fatigue, migraine, exercise intolerance, pain, all of it. Now, if you're looking at this, you're like, man, that's a lot. Exactly. So imagine you're at physical therapy and you go in there and you say, hey, I've got a concussion, and they're trying to treat you purely from your pain perspective. What do we expect? We expect you're not going to get better. What if you do vision therapy, and vision therapy just comes in here and says, hey, we're going to use vision therapy right here, and we want to knock out the rest of these on just by vision therapy. Also going to have a pretty low success rate. What if we come over here and we say, hey, there's some blood flow perfusion issues, and we're going to use hyperbaric as our standalone therapy? Now, you're going to see ultimately it can't hit enough arenas. That doesn't mean that some people may not get better if they do hyperbaric, but it does mean that it's wildly unpredictable. And it's why you'll have those who on Facebook groups and Google and in different forums, they're raving about it. Like, dude, best thing ever. And then people are like, dude, I tried it. I did 60 sessions. That was a complete waste of money. I spent over $10,000. So, and unfortunately, I've been doing this work for over a decade. Most people who treat concussions, they go after the symptoms. They don't take this into mind. Because I'll tell you, when we look at the long-term effects of concussions, chronic traumatic encephalopathy, Parkinson's, different types of dementia, it all lies in the neuroinflammatory response and the cellular energy-based issues. Like, that is where it lives. Receptor dysfunction, that is where it lives. And so you have to have a complete treatment plan. If you don't, honestly, success rates really, really go down. And we're going to talk about what some of those things are that should be considered. So here's things that people come to my office. They've already tried vision therapy, prism glasses, vestibular therapy, medication, supplements, hyperbaric, neurofeedback, upper cervical, injections, and many more. Okay. They spent tons of money and they're frustrated because most of these are really trying to hit one thing, and they're often doing these as isolated therapies versus stacking them together, because you really do need to stack things together. And then I think it's also important that we know that vestibular therapy is a term that's becoming more common and people are using it, but the training and the skill of those evaluating you for vestibular therapy and performing the treatments is all over the place. It's very much like saying, hey, right, can you play the guitar? It's like, well, yeah, right. But you're playing it at an elementary level versus a rock band level. Okay. The skills all over the place. You're technically doing it, but there are so many nuances. And then vision therapy is just all over the place as well. Some people, it just means prism glasses. Others, it means they just completely work on vergence and that's it. But as we talked about, there's a lot of things that happen. So if you only treat one, success rate goes way, way down. And it's why people leave frustrated. So what do things look like and what should you consider first? So this is from a research study, Hiding in Plain Sight, Factors Influencing the Neuroinflammatory Response to Sports-Related Concussions. Okay, so this is a journal article, and it's about basically saying, what was your state heading into this injury? A lot of people say, well, I was perfectly fine. Well, were you on medications? Did you have issues with sleep before? Did you have a lot of stress? What was your nutrition like? What was your exercise level, right? So there are a lot of factors that predispose people to persistent concussion symptoms. And those need to be addressed too. So let's say you already had sleep issues, or you already were getting sick frequently, or you've been exposed to mold and you're dealing with that, or you've got an autoimmune response, or you eat ultra processed foods and your brain's already in an inflammatory response. Let's say you've got the best vision therapist in the world, and that's what you need is vision therapy. If you have those things pre-existing, guess what's going to happen? You're probably not going to get better, right? This is like saying, I'm going to plant something and I want it to grow, and the soil's garbage. It doesn't have good nutrition. It doesn't have a water supply. So that needs to be done. And this is one of the big reasons that even those that are fairly good at vestibular therapy, they're not helping as many people as they could. And it's because they're trying to overly simplify what is not a simple injury. So everything does tie in. Now, I do want to show you a little bit of what are some of the treatments that could be and should be considered. So here we're using called Brock beads or Brock string. Okay, this is keenly used for convergence. So people with concussions can end up with convergence insufficiency. So basically, you're looking at something, it's coming in, and you're going double. Anything within 10 centimeters is considered normal. Anything beyond 10 is considered abnormal. So this is a component that can be there. It's not always an issue. Okay. So don't think, oh, well, I'm seeing it here. This is stuff that has to be done on everyone, because it's not true. Next, we tend to do a lot with hand-eye coordination, with cognitive tasking, and blend and balance. Okay? So when we look at brains, healthy brains, they've got a few things in common. They're fast, they're accurate, and they're cognitively flexible. So you may notice that if you're in a routine, you do okay. But if you start having to multitask, you have to layer steps upon each other. Now you get thrown off, and that's really going to throw you for a loop. We also will use things like blaze pods, where we're doing, once again, more hand-eye coordination, but this time it's based upon color. And what you don't see is that maybe we'll start with this, but then we always blend in balance. So you've got to integrate the systems together. You shouldn't do vestibular therapy on its own. You shouldn't do vision therapy on its own, because we don't live in that world where it's like, oh, I'm doing this on a bland background. It's like, no, like you've got to be able to do this while you're walking, while you're having conversations and everything else, when there's other external noises, because we live in a very sensory rich environment. And if you can't do it in that, then you're not going to get back to where you should be, and you're frustrated. And it's because the care isn't dynamic enough. We also get a lot of neck issues with concussions, whiplash injuries as well. So this is using something called motion guidance, where we're retraining the brain to control the neck. So for example, my daughter was having really bad motion sickness where she'd actually throw up if we would do drives of like 2 to 3 hours, especially if we were going around curves and stuff like that. Brought her in, did treatment, completely knocked out all her motion sickness. Now, this was without any known concussions, okay? But just with how the brain was processing, this was a big issue as well. And if you are doing chiropractic and you notice your adjustments aren't holding, it's because it's being approached wrong. So an adjustment, right? Stimulate, right? We're going to adjust, stimulate the joints. We're going to stimulate muscle activity. That's going to fire into the brain. And the brain has to say, do I like that input? If the brain likes the input, you're like, wow, I felt really good and I feel good for a considerable period of time. If you get adjusted and you only feel good for a couple of hours or a day, that is your brain basically saying, thank you for the input, but no thank you. That is not the information that we need. There's something else that needs to be dealt with. Let's deal with that. And then I will gladly take that adjustment. But till then, we are reverting back to where we were. So a lot of people do chiropractic and they note short-term results and it's not lasting. And it's because the brain component, your vestibular system, your visual system is being ignored. When it's addressed together as a whole unit, that's when people notice lasting results. So for example, even though I'm a chiropractor, I don't really do any adjustments. I let others who love that a lot more do it. And what we noticed was whenever I would rehab their brain, now all of a sudden, these adjustments that weren't holding, that maybe provided temporary relief, now they start holding. And people get sustained relief as a result of these adjustments versus it just being more of a Band-Aid. So that is stuff that really should be known and considered. Next, this is just another picture of what we do, right? So we'll stack things. So there's photobiomodulation that a lot of people are trying. And we'll actually do a whole separate video where I'll have an expert talking about photobiomodulation, really dissecting some of the differences between lasers, red light therapy, where you're laying in beds, right, versus wearing things that have like LEDs and things like that. But we'll do this as well to help to reduce inflammation, support mitochondrial function. And ultimately, it's about stacking it because there's not this one laser protocol that cures concussions. There's not this one vestibular protocol that cures concussions. You've got to hit the dynamics. And that's why I love that research article that I showed you earlier. It is called the dynamics of concussion because there are multiple things. It's not this one thing that people hit and all of a sudden it's thumbs up, everything's great. If you're lucky, that's what it is. But what I find is that in any case that's more moderate to hard, you've got to come at it from the angles of what makes up the injury and why people aren't getting better. You can't pick your favorite thing. You also can't find a provider that picks their favorite thing. They've got to really understand those nuances because it is an injury that impacts how well the brain's connecting, how well the brain produces and uses energy. And it's why you get fatigue. And you notice as the day goes on, you feel worse and worse. It's an injury that changes the immune system in the brain. And it's an injury that also impacts how well your brain perfuses oxygen and utilizes that. So what have I found? I found that most people will get their lives back from a concussion with proper treatment. Now, that is the kicker, is you've got to have proper treatment, okay? It's not about doing only one thing. If you're doing one thing, yeah, you're right, you probably are not going to get better. Or else if you do one thing, don't get better, and then you try something else, you don't get better. And I think that is something we do need to briefly address is I'll get people like, but doc, I already did some vision therapy, or already did some vestibular therapy, or I already tried supplements. Doing things in isolation does not work that well when we look at the world of post-concussion syndrome. It's like saying, hey, let's listen to our favorite band, but we don't want the drummer to play at the same time as the singer, as the person who's got on the regular guitar and bass guitar. Well, you're not going to get the music you like because it's isolated. It is singled out. What you need is stuff that is actually dynamic, and it is addressing the complete dynamics of what a concussion is. And when you do that, that is where you get the greatest results. So I hope everyone found this useful. If you did, please leave me comments and let me know. Also, if you have questions and you have other things you'd like me to cover in future podcast or YouTube lives, let me know that as well, because I really want to provide the information that you need to help you best recover. Because just like my wife, who went over 15 years from her first concussion till we found out why she wasn't getting better, that's unacceptable, period. Like that should not have happened. And unfortunately got brushed off. It got explained away on puberty and hormones. And I know it's happening to you as well. It gets blamed on your mental health. Hey, John just has depression, or Sue just has anxiety. And plus she's a mom. So she's got a lot of stress. And that's where the testing is key, because the testing, like, look, if you're just depressed, you're not going to see the issues with balance and eyes that you see with concussions, right? If it's just anxiety, same thing. So we need to make sure we're really attributing stuff to what it should be, because when we're not attributing stuff appropriately, people are being hurt. They're spending, look, I have patients who spent $50,000 on all sorts of stuff, from hormones to everything else, chasing their symptoms because they weren't evaluated as a whole person. So we've got to get back to where we're evaluating each individual as a whole person, realizing, hey, you can have a concussion plus a thyroid issue plus a gut issue plus hormone issues, right? And you've got to address all of those. But you only do that if you have people who actually can piece together the story appropriately. So I hope this has helped you understand what you should be looking for in an evaluation, and that this is not a simple injury. And the worst thing we do is we try to simplify it for people, and they're like, oh, well, it's this simple. If I just do this, I'm going to be okay. And a lot of people get sold that. And every time they get sold something that doesn't work, that then hurts their ability to try again in the future. So once again, I hope I accomplished my mission of empowering you, of giving you more information that you can act on, just not more information that you consume once and then it leaves. Because concussions, you should be able to recover from the absolute majority of them and prevent those long-term issues that we've talked about. Until next time, this is Dr. Zimmerman, and enjoy.
If you have found the material valuable, please subscribe to my YouTube channel, Dr. Spencer Zimmerman, and leave us a 5-star review on Apple Podcasts or where you normally listen to podcasts from. If you would like to work with me, visit peakbrainandbody.com to learn more. You can find me on YouTube, Instagram, Facebook, or TikTok, all with the handle Dr. Spencer Zimmerman. I'm also on X with the handle Dr. S. Zimmerman 5. This podcast is for general information purposes only and does not constitute the practice of medicine, nursing, or other healthcare professional services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials are to be used at the user's own risk. The content on this podcast is not meant to be a substitution for medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they have, and should seek the assistance of their healthcare professionals for any such conditions.